What's going on, everyone? Happy Sunday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Sunday edition of the Pandemic Update for Sunday, August 11th, 2024. If you're new to my channel, this is where we do the daily pandemic update, where I go over all things COVID, any other virus that could be a health threat to you, air quality levels, heat-related illnesses, pollen levels, COVID in wastewater, other viruses in wastewater. We go over a lot of different things to keep you informed with what's going on, not only in the United States, but sometimes around the world. As you see, we're going to start off internationally today. You need to be informed with what's going on. Oftentimes, people come down with something and they get sick and they think it's just a cold. That is not always the case. A lot of times, it is COVID, and unless you test for it with one of these at-home tests or the PCR testing, you're not going to know that it's COVID. And you need to know whether or not you've had a COVID infection, because COVID can go on to cause a lot of long-term issues. In fact, COVID can go on to cause long COVID, which is a serious condition. A large number of people do go on to develop long COVID, and it only takes one case for it to happen. And if you don't get long COVID with a case of COVID, the more times you get COVID, the more likely you are to get long COVID. Want to be informed with what's going on? Just subscribe down below. Give this video a thumbs up. Hit that notification bell. Share these videos with anyone you know. And leave a comment down below. It's Sunday. Today is Wastewater Day. We're going to spend at least 60% of this video talking about COVID and wastewater, but we're going to get through some daily things first, and that is a couple news stories we're going to start off with. Finland, COVID cases are climbing. Finland's health agency said the viral situation in Finland has worsened as the number of cases has risen slightly across the country, and you can see in this chart provided by Corona Heads Up on X, yes, their cases are rising at this time. Also from Corona Heads Up, Hong Kong is seeing an increase in COVID cases. They reported 4,500 COVID cases in the last week. 7 outbreaks are ongoing right now in care homes involving 60 patients. You know, elderly, older adults, so that's not good, and they do say the situation is worrying. I thought I would share this with you today. Now, I've been tracking the best I could the outbreak of COVID and other illnesses and everything that's going on in related to illnesses at the Olympics, but the Long COVID Foundation has done it much better than me, and I admit it really was hard to do, because you get some of these stories that say multiple players of this team, well, total of 40 players. It was really hard to get a good count. The Long COVID Foundation was able to do that, and they have done a fantastic job of doing so. I want to read you some of what they have put. The ongoing COVID Olympics just keeps creating more ill. Here are some of the notable things from the last 3 Olympics. I think they mean this Olympics. 115 on the list of Olympians, 4 of those being groups of people unable to compete in competition, events, or finish events. Then we come down to this, and they actually have a number of how many who had COVID at this Olympics so far. I mean, we may find out more. There's still the closing ceremony today, but here we go. 69 contracted COVID, making them unable to compete. 17 more had illness, maybe COVID, making them unable to compete. 24 current and former Olympians have long COVID. That's a significant number. Now, someone's going to probably type, well, there were thousands of athletes. Okay, yes, there were, but we did witness some notable events happen. At least 5 or 6 people collapsed during this Olympics. I don't ever recall watching so many people ill, short of breath, collapsing prior to the COVID era, so this is pretty significant. 53 athletes have suffered from illness at the Paris Olympics, 3 coaches and family members as well, and it even says here 2 died. I don't know where they got that number from, but yeah, this is really significant, and then it just goes on. If you want to read this full thread, I did tweet this out, and it will make today's thread on my website for list of sources and list of news stories used in the outbreak. Want to know what my website is? It's datareport.info. It's free to sign up to become a member. Anyone can post on here. There are just a few simple rules. One of them being a COVID positive archive. I do have some guidelines to follow. If you're going to add to that, you have to have some sources, and you can't just say, well, so and so or I tested positive. No, it's actually for celebrities. But there are other places where you can talk about that as well. There's a couple sections where you can talk about what's going on with you and COVID. And if you want to find studies or anything else, it's on there, and it's always growing. I'm adding stuff daily. I just got around to adding, let's actually refresh this because it will come up here. I actually did just get around to adding Rod Stewart's case of COVID. And you can see right there, added that. I actually updated the Olympics thread, and I might add the tallies with the source of that tweet from the Long COVID Foundation as my tally in my thread. Because like I said, it was hard to keep track of with so many conflicting news stories. All right, moving on. The UK in the past week, cases dropped. It was 2,957. And now moving on to today's allergy levels. Drum roll, please. We have to refresh this. Ooh, this is not good. We're seeing some red showing up. There's red in Massachusetts, red in portions of Connecticut, Ohio, Michigan, Wisconsin, Indiana, and portions of Colorado. Red being high levels of pollen in the air, and moderate is in a lot of states. 36% of the country is coming up moderate, but if I had to look here, it looks to me as if it may be more than 36%. I'm just saying, let's refresh this. No, it still says 36%. Air qualities for today. It's kind of a mixed bag. It's not as bad as it has been unless you're in the West Coast. And the West Coast, it continues to be bad, and I'm seeing more purples here. Take a look at this. California. Yes, Colorado too. Even Colorado in northeast of Denver, not terrible, but it's manageable. But California, Oregon, Idaho, portions of Washington, Montana, Wyoming, northwest Utah, Nevada. You get the idea. And then on the East Coast, it's just North Carolina on southward through the Gulf Coast, on up into Texas and portions of Oklahoma. The Northeast is not doing terrible. The Great Lakes is actually doing fantastic today. And if we went up into Canada, there are some problems in Canada as well, especially in Alberta and British Columbia. Wow. Yep, not good at all. Moving on to heat-related illnesses, they continue to be a problem. Don't know why this is coming up, but they do continue to be a problem. And they have dropped a little bit, and I think that may continue. It's not as hot right now. Taking a look at my other Twitter account. Yes, we do have another Twitter account that I use on X, and that is Climate Data Report. All things weather and climate related stuff there. All right, unfortunately, I have to show you this and give you a real quick story. Yesterday, 871 EMS incidents, again in Philadelphia. It was a nice day yesterday. It was not hot. It's summertime. It really should not be like this, but here we are. I mean, we're in a day where long COVID is a thing. And also, I'm going to say this as well. We also have a large number of baby boomers that are starting to get up in age. Maybe that's contributing to it as well. I don't know. It really seems to me that this is about one of the worst summers I have seen yet in Philadelphia for EMS calls. And yesterday, you may have heard during the pandemic update, I know I noted about it, there was an ambulance in the background. Unfortunately, a neighbor had to be taken away yesterday to a hospital, and that was around 3 o'clock in the afternoon. As of 9:30 last night, I got an update. They were still in the emergency room because they could not find a bed for him. Yes, very sad. I haven't gotten any update today, but yeah, nearly 7 hours waiting for bed. That's the normal nowadays, but in the summertime, that should not be a thing. Wintertime, yes, that was a thing before COVID. I can recall having cases when I was a caregiver many times, years ago. We're talking long before COVID. We're talking over 10 years ago, where, yes, we would be sitting in an emergency room waiting for a bed for my grandmother. All right, take a look at this. Yeah, it's busy right now. Wow, I'm actually surprised. A few minutes ago, it was not like this, and I'm seeing the word emergency a lot. Cardiac emergency, 1 time, 2 times, 3 times, 4 times. Respiratory emergency. Yes, there are calls to be had. Hopefully Cheshire County is still quiet. Yeah, well, I'm seeing sick person twice, respiratory difficulty twice, sick COPD and heart problems. Not terribly busy. All right, let's look at something we have not looked at in a very long time, and this is because the fact that, well, I knew of my local hospital being full. I want to know what's going on in Maryland because I knew Maryland had a dashboard for that. And wow, take a look at this. Last night was bad. It wasn't too bad this morning. Now it's starting to get bad again. Yellow alert. You know what yellow alert stands for? That means emergency department temporary request. It absolutely receives no more patients. That means they're overwhelmed in the emergency department. And that's happening in not one, not two, but three, four, five, six, seven, 8 different hospitals in Maryland right now. Upper Chesapeake Medical Center, Howard County General Hospital. In other words, they are really busy right now. And then you see red alert, and that's popping up a lot of times too. And it says the hospital has no ECG monitored beds available. These ECG monitored beds will include all inpatient critical care areas and telemetry beds. And there's a lot of red popping up. I don't know if we can see other regions right now. Yeah, we're not going to sit here and wait for that. I was trying for that last night, and that just was not working either. And then there's also reroutes showing up. An ALS BLS unit is being held in the emergency department of a hospital due to lack of available beds. And we can go to another source here and look at this. Wow. So here we can see some of the other um, areas. And look at this. Baltimore Washington Medical Center. 4 units are being held up right now because they just have no beds. And look at the red alerts and yellow alerts. Yeah, Maryland is not doing so great right now. And we do know COVID cases have been rising there. This is just totally ridiculous for the summertime. It should not even be a thing. All right, let's get to wastewater. The rest of this video will be wastewater. Taking a look at Pennsylvania's wastewater, we do note wastewater's been rising in Armstrong County in western Pennsylvania, Cumberland County, Dauphin County, that's central Pennsylvania, Dauphin County being where Harrisburg, the capital, is, Delaware County, Montgomery County, Lehigh County, and we're going to really be watching Lehigh County because Bethlehem is having that big event. I'm going to show you this again, and that's obviously not it. Here it is. Music Fest. It drawed 1.3 million people last year, so we note wastewater is already rising there. It started last week, and it wouldn't surprise me if we see a large increase there. And if we don't see a large increase, hey, that's a great thing, but I think we're going to. And Sturgis, South Dakota, I don't think we're going to be able to see any wastewater sites there. Saratoga, New York, we will be able to take a look at that. Continuing on with Pennsylvania, we also do note Monroe County, you know, the Pocono Mountains, huge tourist area, not just in the summertime. Though it is busier in the summertime, skiing in the wintertime is a thing too. And up in Scranton, Pennsylvania, it's rising there. We're going to be keeping an eye on the next few weeks on Center County to see if things start to rise because Penn State's going back soon, and already students have come back. Some of them have come back, not all of them. Just some of them move in early, and I'm already hearing stories of students being sick and needing to visit the urgent care. Canada's viral level today is moderate for COVID. Flu A, flu B, RSV is low at this time. Taking a look now, let's, you know what, let's shift gears for just a second. I did want to show you this. The latest variant, which is responsible for extending this summer COVID wave, is the KP 3.1.1 variant at 27.8%. All right, let's take a look now at the CDC wastewater page. And we do note very high levels of COVID across the country. And taking a look here, we can see here, there's a lot of red on the map. Red is the highest level, 80 to 100% increase. That's right, your wastewater treatment facility or sewer shed, they can actually go take a sample and find out what the level is in your local community and then spit out a result. And well, a lot of these sites here do make it onto this map. And you can see here, red really does rule the roost, as does orange. Red and orange rule the roost right now. We would like to see more dark blue colors. That's 0 to 19% COVID detected. There's just very few of those sites at this time. There's only 36 of them. And meanwhile, there are over 1,000 sites on this map. Yeah, not good. Gray means not reported. You get the idea. And white sites are new sites. We're going to go to the northeast first, then we'll make our way out to the west. And take a look here. As promised, Saratoga, New York. Not being impacted by those horse races just yet. Remember, New York has been getting hit for quite some time. And it would seem along New York State thruways, the north-south and the Northway, Adirondack Northway, that area has peaked. New York City has peaked as well. But then when we go out to western New York, take a look at this. Niagara, and mind you, some of this data could be lagged. It could be behind as much as a week. But take a look at this. A lot of red showing up out there. Yeah, I mean, all these ways, orange sites. Here's one that's dropping. That is good to see. Let's try the neighboring site. That's dropping as well. That may actually have an issue with it. Here's another one that had dropped slightly. So we are seeing at least some dropping, but here's Oswego, and I hope I said that correctly. And we can see here it's rapidly rising there as well. So this is not good to see. Let's go down further south. North Carolina, what's going on there? Cumberland, North Carolina, is rapidly rising at this time. As we come over near Greensboro, Greensboro is still rising, so we are still seeing increases in North Carolina. How about South Carolina? What's going on there? Yeah, South Carolina. Wow. Yep, South Carolina is still rapidly rising. Florida will have to go to wastewater scan for that. Let's go to Ohio real quickly. Hardin County, Ohio. That's still rising for COVID in wastewater. Reminder, this is only just COVID on these maps. Wastewater scan, we can view other things. Franklin County, Ohio. That's where Columbus is. That's dropping at this time. Jefferson, St. Louis area, Missouri. Still seeing rises at this time. Oklahoma, what's going on there? Yikes, Oklahoma is rising still. Wow, I'm actually surprised how many sites we're clicking on that are still rising. I would like to see some that are dropping. Here's one, Santa Fe, New Mexico. That's starting to drop. Keep an eye on that. Hopefully that continues to become a trend. Here's another wastewater site that's rising. How about we come down to San Diego? This site hasn't really updated. I think now would be a good time to, let's see Utah real quickly. Yeah, Utah is still rising. Now would be a good time to switch on to another way that we can look at COVID and wastewater. And this is the viral activity levels map. So in other words, let's take Texas for example. 18 sites reported. Out of those 18 sites, the average is very high. You get the idea here. There's several sites that are very high. Washington, Oregon, I should say states, not sites, but states with sites that are high. Washington, Oregon, California, Alaska. Still Hawaii is coming up high. Hopefully that will drop even lower soon. Utah, Wyoming, and Minnesota, all very high. North Carolina, obviously, still very high. Florida is, even though Florida has likely peaked, they are still very high. And you get the idea. High here in Ohio, and it looks like very high in Maine and portions of New Hampshire. Vermont is coming up at high at this time. We'll have to keep an eye on Vermont. Vermont's still been rising. That could go to very high. Now let's go over to wastewater scan, and we're just going to do COVID here today. We usually would look at other viruses. Given we've already gone 17 minutes, we're just going to do COVID. So nationwide here, we can see that, yeah, there's kind of some wonky movements here. It was starting to level off, which is a bit different from what the CDC is showing. Then when we go to the Midwest, we can see here that levels are starting to drop slightly for COVID in the Midwest. In the Northeast at this time, levels, there's a wonky movement here. And that wonky movement would indicate that maybe it is trying to go up once again. In the South at this time, we can see levels, they tried to go back up, but now they're starting to go back down once again. And I think that's going to continue to be the trend. When we take a look at the West Coast, yikes, look at this. A little wonky movement, but no, let's be serious. The West Coast, and we saw a report yesterday showing the West Coast is still rising. So even if that's corrected, there is still somewhat of a rise in the West Coast. And I do want to show you, I believe it was Los Angeles that I wanted to show you. There is still a rise going on there. Take a look. No, that's not it. Come on, Los Angeles. And we can see here, we will get Los Angeles to come up. Here we go. And Los Angeles County, we can see here, take a look at this. The overall trend continues to be higher, which is not a good thing whatsoever. But the good news is, if we go to LA's dashboard real quickly, we can see here, cases are starting to peak. So hopefully that's going to drop relatively soon. Hopefully it doesn't mean it's just, oh, people have stopped testing. I want to think that cases are going to start to drop there relatively soon. Let's go up to Salt Lake City area in Utah. And we can see there, take a look at this. COVID continues to rise there. Let's go somewhere down in, further into the east now. How about we go down to what's going on in Chattanooga, Tennessee. And hopefully we will see, nope, things are still rising here as well. Wow, there are a lot of places that are just not dropping yet. And this is not a good thing whatsoever. Let's go up to Warren, Michigan. I'm hoping to see, can we find one site that's actually dropping? Now here, it's a lot of wonky movements, but again, overall, it's trending upward. Let's do another Michigan. How about Jackson, Michigan? I'm really hoping here. Okay, this one, it's still rising, but it's not, we're not seeing vertical movement, which is a good thing. With that, coming down here to Kentucky, let's take a look at what's going on there. Kentucky has not been doing well whatsoever. This is Louisville area, and we can see, yes, finally we found a wastewater site that is dropping slightly. And let's go down to Georgia. How about we take a look at Atlanta area? How about we come down to College Park, and let's see what's going on there. Take a look at this. Now, it hasn't updated much. It's only started updating back in June for some reason. But take a look at this. It is showing signs of starting to drop. Continuing on, we're going to do a couple more here. We'll go a little longer than normal for our video today. Let's go to Arkansas and see what's going on there for your COVID levels. And Harrison, Arkansas, we are starting to see a drop at this time. Houston, Texas, take a look at this. We do see a lot of wastewater. So this is as of July 29th. It's a bit delayed. A lot of sites now that are either flat, starting to drop. That's good. There are still a few I'm seeing 5 up indicators here, but we're also seeing a lot of places that are now flat. And that is really good to see. Let's make our way back up to the north. Let's go up to Minnesota real quickly. We'll take a look at St. Cloud and see what's going on there. And we do note St. Cloud is starting to drop, and I want to be fair. So let's go back to the CDC site. Here it is. And let's take a look at what's going on up in Washington State, and we can see here we're seeing a lot of red there. Pierce and King County, wow, continuing to rise at this time. Here's another Pierce that's still rising. Oregon, we are starting to see some dropping there, at least at some sites. Lincoln, you're not dropping yet. Let's take a look at this blue site. No, wow, it just amazes me how many sites are still rising. How about Idaho? Can we get any good information out of Idaho? Like, no, nothing, nothing. We come over to Montana, Park, Montana. You're continuing to rise. You know what amazes me the most about this summer surge? It started earlier, and here we are on August 11th. We still have such high wastewater levels. You would have thought, starting earlier, it would peak earlier. New York State did, but for a lot of places, things are just remaining high because it's just been a continuous parade of variance. Alrighty, folks, we have gone long enough for today. 22-minute video. If you enjoyed this video, give it a thumbs up. Subscribe to my channel down below. Share this video with anyone you know. Hit that notification bell. And, of course, leave your comments down below. We'll be back again tomorrow with some weekly numbers, which will include death numbers, which I'm expecting to not be good this week. Until I see you again next time, stay safe, everyone. Have a fantastic Sunday afternoon, and thanks for watching. Take care.